Welcome to the Carnivore Cast, the podcast focused on the carnivore diet and lifestyle, with practical advice from successful carnivores, citizen scientists, and top researchers. I'm your host, Scott Myslinski, and I'm here to speak with experts and experienced carnivores to get answers to your biggest and meatiest questions while helping you live your best life as a carnivore. If you enjoy the show, please consider supporting the Carnivore Cast on Patreon. By becoming a patron, you'll help us reach more people and continue to create content on carnivore. There are also exclusive perks available, such as private Q&As, consultations with me, and more. Become a supporter at patreon.com/carnivorecast. Check the episode description for the link. Thank you, and I'll see you there.
Dr. Philip Ovadia is a board-certified cardiac surgeon and founder of Ovadia Heart Health. As a heart surgeon who was once morbidly obese himself, Dr. Ovadia has seen firsthand the failures of mainstream diets and medicine. He realized that what helped him lose over 100 pounds, focusing on his metabolic health, was the same solution that could have prevented most of the thousands of open heart surgeries he has performed. Dr. Philip is the author of the book, Stay Off My Operating Table, a heart surgeon's metabolic health guide to lose weight, prevent disease, and feel your best every day, which I got a copy of and absolutely love. Welcome to the show, Dr. Philip Ovadia.
Thanks, Scott. It's great to be here with you today.
Yeah. So I guess first question is, how did you become a heart surgeon?
Yeah. So, I always knew that I wanted to be a doctor growing up and never really could pinpoint exactly why that was. I didn't have any doctors in my family. I believe it probably had something to do with my older brother, who was diagnosed with type 1 diabetes as a child. And, I was about 6 years old or so at that time, and probably seeing, kind of what he went through and seeing how doctors helped him influenced me in subtle ways. And I, went through college and medical school, and always knew that I wanted to be a surgeon, and I wanted to do something, in the surgical field. And as I started my training in surgery, I just was attracted towards heart surgery. I found it, just fascinating, the physiology of the heart and the technical aspects of doing heart surgery. And so that was the career path that I decided to pursue. And here I am now, just about 20 years later, and haven't looked back at all.
Yeah, super interesting. And I'm just always curious, like, what does the day of a heart surgeon look like when you're on the operating table?
Yeah. So, and realize that, my day probably looks a lot different than a lot of heart surgeons because of the ways that my career has changed recently. But I do travel work for heart surgery now. It's called locums. And so I travel all around the country to hospitals that are in need of heart surgery services and don't have the surgeons to perform that. And so I'll spend anywhere from a week to 10 days at a time at a hospital. And, the typical day is, starts relatively early in the morning, and seeing, whatever patients are in the hospital. Patients that may have already had surgery or getting prepared for surgery. And then we head to the operating room, and depending on the day, I may spend anywhere from, 4 to 8 to 10 hours in the operating room, and that can be usually on, multiple operations, but sometimes one long operation in a day. And then kind of at the end of the day is the wrap up of, going back and seeing the patients that are in the hospital and dealing with whatever, other new patients need to be seen. And then, it can be very unexpected and very unpredictable, because sometimes heart surgery is an emergency situation that, will get called in the middle of the day or in the middle of the night, needing to do surgery. But, so overall, it's hard to say that there's a typical day. But I would say it's never boring, and it's always interesting. And I feel blessed every day that I can, help people who need that service and, who need heart surgery. But, as we're going to get into, the other thing that I've discovered in the last few years now is that a lot of people who ended up on my operating table and needed heart surgery, didn't necessarily need to be there. And there were a lot of steps along the way that could have prevented them from needing the heart surgery. And so I have a renewed interest or a new interest and a passion and a kind of secondary part of my career now in helping people to not need heart surgery.
Yeah, that's fantastic. And thanks for giving some of that detail. And so I want to get into that now. What changed your perception? And was it primarily your own journey to lose weight and get healthier?
Yes, it was primarily my own journey. So, my story goes back that I was, progressively unhealthy throughout my career as a heart surgeon. And about 6 years ago now, I found myself at a spot where I was morbidly obese. I was pre-diabetic, and I kind of knew I was going to end up on my own operating table, so to speak. I was following the path that many of the patients that I took care of had followed. And, I was at a loss as to what to do because I had tried pretty much everything I had learned in medical school as to, how to lose weight, how to be healthy. I had, done the calorie counting and eating less and moving more and eating a low-fat diet and eating according to the food pyramid. And it wasn't working for me, and it wasn't working for my patients. Over and over again, I would see that. And thankfully, I came across some different ideas about why we get unhealthy, why we get obese. And specifically, I was at a medical meeting and heard Gary Taubes deliver a lecture, and he had just written The Case Against Sugar. And of course, prior to that, had written Why We Get Fat. And, what he talked about made a lot of sense. And, the concept of the types of food that we eat being more important than the amount of food that we eat, and the interplay, between those two made a lot of sense. And I read his books and I started eliminating sugar and carbohydrates and ultimately, processed food. And over the intervening years, I was able to lose over 100 pounds. I was able to correct my pre-diabetic condition. And I came to realize, that this is what was going to help, people not need heart surgery. And I came to realize how important, sugar, carbohydrates, metabolic health is in the development of heart disease.
Interesting. And how did you come to grips with that in terms of your role? How did it make you rethink your own role and your perception of how you help people?
Yeah. So it made me realize that, I needed to, take on a different sort of career path, a different aspect of my career, because while I continue to work as a heart surgeon, I really have become passionate about helping people not need heart surgery. And I always sort of, somewhat jokingly say, my new goal is to put myself out of business. And I really would like to get to the point where a lot less people need heart surgery. And so along those lines, I wrote the book, Stay Off My Operating Table. As you mentioned, that came out last year. And I now have a telemedicine practice where I work with people, one-on-one to help them prevent heart disease, or in many cases, manage the heart disease that they already have, in sort of a different paradigm than, they've been used to. And, and then I work with companies as well. I do group seminars and group health management for companies and organizations, and just really, looking to get the word out in any way I can to all of the people who need to hear this important message, because heart disease is the number one killer in the United States and worldwide. It has been the number one killer, in the United States now for over 40 years. And we really have not been making a significant impact on that. And I believe that it is because we've become focused on the wrong things. And we really put much of our effort, really the majority of our effort in the healthcare system on taking care of people once they are already sick. And we have lost focus on trying to prevent people from getting sick in the first place.
Interesting. Yeah. And you have a great section of your book called The System is Broken and What to Do About It that gets into this really well. And one thing I really like, I'm just going to pick out certain parts of the book that I thought were really interesting and really important. You have like some practical advice for people on how to stay off your operating table, obviously, and improve their metabolic health. And one of the sections is make one sustainable change at a time. Can you talk about this and like why that's important, why you chose to write about that?
Yeah. So I think that, as people are trying to, make the oftentimes significant changes that are needed in order to, either undo the damage that's already been done or prevent future damage from occurring. Their tendency is oftentimes to try and kind of, do the complete 180 and change, everything at once. And I find that there are two problems with that approach. The two problems are that if you change everything at once and it works, let's say, you get great results, you still don't really know, which of those many changes that you made were useful and which ones weren't useful. And, if you're trying to make this long-term change, it can be difficult because then you don't know, what you can reintroduce or not reintroduce. More commonly, though, the more common problem with that approach is that it doesn't work. And, people just get very overwhelmed. They get very frustrated, and then they don't really know what to do next. So instead, the approach that I try and get people to take is let's just focus on one thing at a time. And usually the first thing to focus on is the foods that you were eating. And then, once we get things kind of straightened out with your diet, then we can start worrying about the exercise, and then we can start bringing in the stress relief, and then, all the other things that are important to overall health. But I like people to kind of make, one change at a time that they can then track, see the outcomes of that change, and decide if that's working or not working for them, and then kind of build upon that and evolve from there, rather than just trying to change everything at once.
A lot of people ask me about how to make liver more tasteful and how to cook it or incorporate other organ meats on carnivore. Optimal Carnivore can help you do just that with their grass-fed organ complex. It was created by carnivores for carnivores. They start by sourcing 100% grass-fed organ meats from New Zealand, gently freeze-drying the organs and encapsulating them into convenient bovine gelatin capsules. Just 6 of these capsules a day is the same as eating an ounce of raw organ meat. I personally take these every single day, as does my wife. Even though we both eat liver and other organ meats, our ancestors would have eaten the whole animal, and this unique blend has 9 different organs, including beef liver, brain, thymus, kidney, spleen, etc. And I think it's great to get a daily dose of these organs when you can. So it covers all your bases, whether you're at home or traveling. What's also cool is they plant a tree for every product sold, which helps the environment. So visit www.optimalcarnivore.com/carnivorecast and use the code carnivore10 to receive 10% off your purchase. Thanks, and back to the show.
Yeah, I completely agree. And often when I try to help people, that's really something I focus on is what is the smallest change you can make that will start to make a difference. And another section you have that I think is so important for people inside the carnivore community, general people just trying to improve their health, more importantly, is a big barrier people talk about is I can't do this because I need to go to birthday parties. I need to have these family events. I have to go out to restaurants with my family. Can you talk about the section you have on that?
Yeah. So I think that, an important part of these changes is that they do need to be sustainable and they do need to be, adaptable to everyday life. We don't live in bubbles and, we need to be out there, in the world interacting with people. And so, I tried in the book to give a lot of, kind of practical tips that can help navigate those situations. Things like, if you're going to a social event and you're not sure of, what the food options are going to be there, eat before you go to the event. Eat at home before you go to the event, so you're not going to be, starving when you get there. And then, if you get there and there are some things that are, on your plan, you can partake a little bit more. And if there aren't, then you can just enjoy the situation. Oftentimes the food has become the focus of these social situations. And, one of the things that I hope people start to, gain from this is that the food doesn't always need to be the focus. Focus on the people around you, the people that you're with, enjoy the experiences. And good food can be additive to that, but it doesn't need to be the center point of all that. I just think that as we make these, like I said, life changes, these sustainable life changes, we do need to find ways to adapt it into everyday life. And I think there are lots of, ways to do that. And there are, I've had my successes, now over the, 5+ years that I've been doing this. And so in the book, I go through a lot of those little tips that can help people to negotiate those situations.
Yeah, that's great advice. And another section of your book I really like is the big myths. Can you talk about some of the big myths you outline in your book?
Yeah, sure thing. So, again, a lot of my journey ended up being unlearning, the things that I had learned in medical school. And, I really, I talk about how being a doctor in a lot of ways almost worked against me because I had all of these things that I had been taught in medical school. And then all of these things that, both me as a physician and other doctors, end up repeating to patients. And we realize that, a lot of them are just not true. And so, unlearning those things was a big part of my process. And again, as I, went through them in the book, I hope that people will kind of recognize that as well. And really, myth number one, I think is a big one that is very important for people to understand. And that myth is that only obese people are metabolically unhealthy. We have equated, being overweight, being fat with being unhealthy. And many times they do go together. But what's important, and the problem with that myth, is that we then assume that anyone who isn't overweight must be healthy. And that really couldn't be further from the truth. When we look at the statistics around metabolic health, while it is true that, if you were obese, your chances of being metabolically unhealthy are, 95%. If you are not obese, your chances of being metabolically unhealthy are still 50%. So half of the non-obese people are not metabolically healthy. And, that myth, I think, is a very important one, because what that leads to is that a lot of metabolically unhealthy people who are not overweight don't realize that they are metabolically unhealthy and therefore don't take the steps to reverse it until it ends up being, a big problem, like they are overtly diabetic or they develop heart disease and they are on my operating table.
Are people surprised, both colleagues and, friends, others, when they talk to you and you've developed some of these perspectives on heart health and taking a more preventative approach and taking your health into your own hands?
Yeah, certainly they are. As I mentioned, the healthcare system has become overly focused on taking care of sick people. And, unfortunately, some of that is just out of necessity. There are so many sick people around that it becomes overwhelming. There's basically just an endless supply of sick people for doctors and the healthcare system to be taken care of. So, when physicians like myself start talking out and saying, it doesn't need to be like this, and we can prevent a lot of these people from being unhealthy in the first place, that certainly gets looked at skeptically. And again, it's not that, most physicians don't want their patients to be healthy and don't want to help their patients get healthy. It's just that they truly don't know how to do that. They truly, in many situations, don't even realize that it's a possibility. One great example of that is, you look at type 2 diabetes, and the standard dogma in medicine around type 2 diabetes is that it is a progressive disease that, you can try and manage. You can try and keep the patient's blood sugar under control as best you can, but that is going to involve more and more medications over time, and that the natural course of the disease is for it to get worse and then lead to, complications down the line. Yet we have, very good published data from Ovadia Health and others showing that type 2 diabetes is reversible. And, Ovadia Health published their results that at 2 years on their program, 6% of their type 2 diabetic patients had their condition reversed, meaning they were off of their medications and their blood sugars were normal. Again, most doctors are not aware of that. Most doctors have not seen that data and do not think that type 2 diabetes is a reversible disease.
Yeah, I think that's a great perspective and really important message. And in your book, you talk about how to eat metabolically healthy on different diets. So I have to ask why you chose to start with carnivore, but you also include all different types of diets, including vegan and vegetarian.
Yeah. So again, this gets back to, making this work for the real world. And, one of the things that I intentionally tried to avoid, and I did avoid in writing this book, was giving everyone the Dr. Ovadia 28-day diet plan and saying that that is the only way to be metabolically healthy. And while I personally find the carnivore diet to be, the most, the easiest way, I should say, the most satisfying way for me to maintain my metabolic health. And I have now done that for, over 3 years on a carnivore diet. I do recognize that it's not the only way to get metabolically healthy. And what was interesting to me, and what I tried again to point out in the book, was, what are the commonalities between carnivore, vegan, paleo, Mediterranean, keto, all of these different diets, because we certainly do see a lot of people succeed with all of these different dietary plans. So what is, the commonality? And, for me, the biggest commonality that stands out is eating whole, real food and eliminating processed food. And I think, the more that you can do that within whatever framework you want to work within, the more successful you are going to have in terms of improving your metabolic health.
Yeah, that's great. And just out of curiosity, what would be the 28-day Dr. Ovadia meal plan?
Yeah, so as I said, I maintain a largely carnivore diet. I eat meat, seafood, dairy, eggs, and not a whole lot else. On an occasional basis, I'll have a baked potato, or I'll have some honey, or something something non-carnivore, but for the vast majority of the time, I maintain a carnivore diet. And like I said, I just find that to be most satisfying. I find it to be easiest to maintain. I find the shopping is easy, the preparation is easy. The planning, there isn't a whole lot of planning that needs to go into that. So that's what works best for me. But I do truly work with patients, in my practice that are doing everything from vegan to carnivore and all the various low carb, iterations in between. And they all are able to find success as long as they stick to the underlying principle of eating whole, real food and elimination of processed food as much as possible.
Yeah, I think that's really the big rocks. And has that been a gradual evolution for you, or did you move very quickly to a more carnivorous diet?
Yeah, it was a gradual process for me. As I mentioned, I started, with Gary Taubes and eliminating sugar, and then, ultimately kind of minimizing carbohydrates, and got into, what I would call a traditional keto diet for quite a while. And I found myself getting lower and lower carb keto, and was down to very, exceedingly low carb keto, probably under 20 grams a day. And then I, heard about carnivore. I came across Sean Baker and, heard about what he was saying. And admittedly, at first I was kind of like, well, you can't really only eat, meat. But I looked into it and I thought about it, and I said, well, I'm really not eating, much besides that at this point. I'm very low carbohydrate. And so I said, let me give it a try for 30 days. And the biggest difference that I noticed was that, the little bit of inflammation that I still had going on was eliminated. Specifically for me, I had struggled with plantar fasciitis, and, my right foot would hurt every morning when I got out of bed, and I'd sort of hobble around for 10 or 15 minutes. And I had tried all the physical therapy and, everything else to get rid of it. And my third day on carnivore, I got out of bed and I put my foot down and it didn't hurt. And it didn't come back again, the pain in my foot. So, whatever it was that I was still eating on my very low carb keto that was causing some persistent inflammation, I finally was able to eliminate and, heal that with a carnivore diet. And then honestly, I just stuck with it because I do find it so satisfying, and it is, easy for me to maintain, with my schedule. And, but as I said, I don't think it's the only way to do it. It's what works for me. And what I do with my patients is find what works for them.
Yeah. Thank you for sharing that. That's an excellent perspective. And I'm also curious, you had reviews or maybe testimonials, you would call them, in the front of your book from like Dr. Tro and others. Do you keep in touch with other low carb or carnivore doctors?
Yes, definitely. One of the things that I am always interested in and always working on is how do we, grow this community together. So, Tro and Brian Lenskis were instrumental in helping me, kind of start my practice, my telemedicine, metabolic health focused practice. And I learned so much from all the other physicians in this community. I love going to the low carb medical meetings. I was, recently at the Low Carb USA meeting in Boca, and had, just great interactions with all of the physicians and non-physicians there, everyone else involved in the movement. I'll be going out to the Metabolic Health Summit in Santa Barbara in May. And I interact with as many of the other physicians in this space as I can on a daily basis. I'm usually exchanging emails or hopping on a Zoom with someone to discuss what we can do as a community to, move to continue this movement and continue the growth in the movement. Because again, the unfortunate reality is that there are way too many sick people out there, and there are so many people that can be helped, with a focus on metabolic health, that it's not like, any of us need to be in competition with each other. There's more than enough work to be done. And, I think we all bring our unique perspectives to this, and we all need to be working together to just get the word out about metabolic health and how we can grow the metabolic health movement.
Yeah, that's great. I'm really happy that that work is going on and that you're helping lead it as well. Where does medication come in for heart health? ARBs, statins, what role do you think they serve?
Well, I think that question is really evolving. Obviously, the mainstream take on that is that medications are the cornerstone of, both prevention and treatment for heart disease. And the unfortunate reality that we see is that, when we specifically look at statin medications for prevention of heart disease, they really are not living up to the promises. And, statins have been the most widely prescribed class of medication in the United States now for 20 plus years. And we haven't seen a noticeable impact on, heart disease during that time. And so that tells me that, they're not doing what they're promised to do. And that doesn't mean that they have no role. It just means that, we shouldn't be depending on medications and only medications to deal with the heart disease epidemic. And, that was another sort of indication to me that we need to be doing something else. We need to be doing something more to prevent heart disease. And I think, focus on diet and the proper focus on diet, not the low fat, diet that has been put forward as preventative for heart disease, is where we need to focus on our efforts moving forward. So, when I work with my patients, I always have the discussions about medications and whether or not they might be useful for their individual situations. But those, I would say that those conversations are more nuanced than, most doctors care to have. And just like there isn't one right diet for everyone, there isn't one medication that's right for everyone to be on. And unfortunately, a lot of the times in medicine, that is the messaging that, if a certain blood marker is above X, that you need to be on these medications. And I just find that is not a useful approach to, preventing and managing heart disease.
Interesting. And one thing I read, I need to get your take on this, on a low carb site that shall not be named several years ago, was that one of the main reasons why men have higher cardiac risk and higher rates of heart attacks, et cetera, is because women have an outlet for releasing stored blood. Women menstruate and men don't, especially later in life. And so blood gets thicker. And by donating blood, it's essentially a way to vastly improve longevity and lower your heart disease risk. Is there any truth to this?
I would say in general, it's not that simple. So there may be some role in iron. Iron overload is basically what is being talked about there, and there probably is some role in. Iron overload probably does play some role in heart disease for some people that develop it. But again, it's not that simple that, that's the main reason why people are developing heart disease. And, there certainly are situations where, for certain patients who have certain conditions, that blood donation, is an important part of their management and can be useful to, prevent heart disease as well as other conditions that can come from having excessive iron in your body. But it's usually not the first thing that I'm focusing on with my patients when I'm helping them to prevent or manage their heart disease.
Got it. Yeah, that's really helpful. And Philip, I wanted to ask about your metabolic health tracking system that you talk about in your book. What is that, and what is the idea behind that?
Yeah, so the metabolic health tracking system is a supplement to the book that's available, and it kind of goes beyond, what I could put in the book. So it has a number of components to it. It is a tracking system, so it does sort of give you a spreadsheet and some useful metrics that you can be tracking as you're making these changes to figure out if they're working for you or not. I also have things like shopping lists in there that can help you, navigate the grocery store and select the items there that are going to be supportive of your metabolic health. I have a list of questions that you can ask your doctor, that can serve as sort of a framework for a discussion around metabolic health and to help you figure out whether your doctor really understands metabolic health and is going to be able to support you in your metabolic health journey. Because, I think that's another key principle. It's one of the 7 principles of metabolic health that I talk about in the book, is that, you need to be working with a doctor or, a practitioner of some sort that is your partner in this journey and is going to be able to help you in the journey. And unfortunately, a lot of the doctors, a lot of the healthcare practitioners that are out there just don't know about metabolic health and therefore aren't going to be, helpful for you as you're trying to improve your metabolic health.
That's great. I think that's a great resource for people. Well, Dr. Ovadia, it's been an absolute pleasure. Thank you so much for coming on. I'm sure people will get a lot from this and highly encourage them to check out your book. Where can people find you and follow along and learn more from you?
Sure thing. So again, the book is called Stay Off My Operating Table. It's widely available, Amazon, Barnes & Noble, all the other usual online places. And it's in both print, electronic and audiobook versions. My website, ovadiahearthealth.com. So OVADIA hearthealth.com has, all the links to everything else that I'm doing, all the podcasts that I appear on, as well as the podcast that I host, the Stay Off My Operating Table podcast. And it also has a link there that people can book a call with me to discuss whether joining my practice would be a good option for them. As I mentioned, I have a telemedicine practice. It's all online, virtual. I work with people throughout the United States. So I encourage people to go to the website and check out all the great resources there.
Great. I'll certainly have links to that in the show notes and at carnivorecast.com. Thanks again for your time, Dr. Ovadia.
Thank you, Scott.
If you enjoy the show, please consider supporting the Carnivore Cast on Patreon. By becoming a patron, you'll help us reach more people and continue to create content on carnivore. There are also exclusive perks available, such as private Q&As, consultations with me, and more. Become a supporter at patreon.com/carnivorecast. Check the episode description for the link. Thank you, and I'll see you there. Thank you for listening to this episode of the Carnivore Cast. If you enjoyed this episode, please review on iTunes. It really helps us out. And share it with a friend. What questions would you like answered, or who would you like to hear from in the carnivore research community? You can find me on Twitter, Instagram, and Facebook at CarnivoreCast, or go to carnivorecast.com. You can also email me at info@carnivorecast.com. I'd love to hear from you. Until next time, keep it carnivore.